Hi guys, Dr. Chris Heimlich here, and most thyroid problems are an autoimmune condition. And autoimmune problems, they're on the rise. Now, if you have a thyroid, low thyroid symptoms, there's a high chance, very, very high chance, about 90–95%, that you have an autoimmune condition called Hashimoto's thyroiditis. We've talked about it a lot on our other post, where the body attacks the thyroid. Unfortunately, it tends to attack other parts of the body as well. I mean, it's common knowledge, and research shows it. And most doctors and researchers consider low thyroid symptoms, having hypothyroid, synonymous with Hashimoto's, even though they don't do anything to treat the autoimmune component. And we'll be talking about that in another post. And most people also don't realize that if you do have Hashimoto's thyroiditis, you're more likely to have other type of autoimmune conditions because they tend to run in packs. Now, the number of autoimmune conditions are over 100, and it's growing. And we're going to take a look at some of the precipitating factors on why these numbers are growing. Now, I mean, normally, the immune system recognizes what's self and what's not self. And anything which is not self isn't tolerated, and it's attacked. And the key word here is identified. So we have to see, why is the body not identifying itself as normal? I mean, that's the million-dollar question. One big reason is genetics. If mom has thyroid problems, the daughter's probably going to have thyroid problems, and the granddaughter's going to have thyroid problems. I mean, I see 3 generations of women sometimes in here from all over the place that have thyroid issues because it's an epigenetic factor. So that's one of the reasons. What's some of the other reasons that you can cause this blurriness of the line between self-tolerance and non-self-tolerance? Well, it could be around infections. Now I'm referring to chronic type of things, bacterial, viral, parasitic. You could have bacteria, yeast infections causing these different radicals in the body, causing a whole different cascade of inflammation to go on. Other factors can include old age, stress, lack of sleep, hydrogenated oils, a junk food diet, physical trauma, systemic acid in your body. Now, researchers are also discussing that pesticides could play a big role in this too. Plastics can, food allergies. There's some suggestion as far as vaccines, low vitamin D. It can all cause these type of things, increased reasons for autoimmune conditions to be on the rise. Now, but regardless of that, ultimately what happens is this will cause poor digestion and dysbiosis. Why is that? Because about 50–70% of our immune system by weight is in our gut. It's in our gastrointestinal system. And of course, I know a lot of you guys probably have already realized this by your symptoms, because you're like, oh yeah, is that why I have constipation and or diarrhea, or I have upset stomach, along with my other low thyroid symptoms like my hair falling out, I'm fatigued, I'm lethargic, depressed, all those other different types of things. Yeah, absolutely. But you know what? There's things we can do to test to see if you have any of these things going on in your gut. There's tests you can do. And there's stool tests, and some of them out there are really great. Others of them out there, you might as well just save your copay, because they're really lacking. And I'm going to be going over that in another post here. That's not what this post is about, but I have a new post going to be coming out real soon here. That's going to talk about the differences in tests, just like there's differences in doctors. Some doctors will just do a little testing, or they'll do some different type of test that may be antiquated. Why? Well, they probably just don't know any better. They haven't done any of the latest research in them, the last 5 years, 10 years, 20, 30 years. Maybe they haven't done really anything. All they do is just do what everybody else does. And that's the problem. You have to continually educate yourself as a healthcare provider now, because there's more and more information out there. I'm not going to get off on a tangent on that. I'm starting to go that way already. But the news is that the big point, you've got to find a doctor. You've got to find someone that understands about autoimmune conditions. If you're suffering from low thyroid symptoms, my goodness, you've got to get tested. And then once you get tested, you have to find someone that helps that knows how to help you, how to manage that. Because just taking thyroid medication is just a small piece of the puzzle. Is it important? Yeah. But is it going to help you feel better? No. Because if it was, you wouldn't be watching the video. You'd be out there enjoying life right now and feeling like you had control of your life. So get out there, find a doctor who understands what we've talked about. Have a great day.